Welcome to this edition of Essential Oil Nurses. We're talking about castor oil today and the benefits of it and our experiences with it. First of all, Ricinus communis. This is a shrub or a tree that is native to the southeastern Mediterranean basin, Eastern Africa, India, Bulgaria. So those are the places that you can look for when you're studying, like where you're getting your castor oil. It comes from the seeds, and our primary constituent, and what we're going to talk about, what we see in the research, is going to be that ricinoleic acid. It's 85 to 90%. That's what we're looking for. It's what all of the research is done on. So if there's any research on castor oil, it's going to be the ricinoleic acid. There are some others, and I saw palmitic acid in the studies as well, and so you might see that some of these other fatty acids. It's cold pressed and from dried castor beans. It should be a clearish color, and again, purity matters. And since we don't have like our source available to us yet, that being doTERRA, and we know that they're coming out with it, and so we're excited about that, but we don't have that yet. And so since we're all using it anyway, we're going to talk about that too. Some fun, fascinating facts about castor oil is, first of all, we know it from, I think it's probably commonly known that Cleopatra reportedly used castor oil to brighten the whites of her eyes. It was one of the earliest motor lubricants used in aviation as well. And so this kind of highlights, I want to bring up that a lot of times in the wellness industry, we have people go to take ingredients and look at ingredients and go, this is also in cleaning fluid or also in motor fluid. So do you really want to put that in your body? So this is going to highlight a little bit of, there are multi uses of some of these. So a motor lubricant, we wouldn't think about a part of a motor lubricant being something that we put on our face, but we do because, but it's all like different chemistry, and knowing our chemistry, why it's important when we take some of these components and we have different uses for them. In many countries, it's known as the palm of Christ because of its healing powers. So that's another name that you'll see it referred to in mostly like Ayurvedic articles and things like that. So some benefits, the ricinoleic acid interacts with prostaglandin receptors, and that's why we can say that it reduces inflammation and pain. There are studies that show it being used for arthritis, sore muscles, for nerve-related pain, and just making that a choice for mixtures, particularly with sprains and maybe some more acute injuries. Also has some antimicrobial and antifungal activities there. It's effective against a whole range of bacteria, supporting, and then this is why we like it for supporting skin health and wound healing and fungal infection. It's used in a lot of ringworm and athlete's foot, but little fungal concoctions. It's used for that as well. We probably know it best for its lymphatic stimulation and detoxing. So this is probably where we end up talking about it most, is that in castor oil packs. Those are the packs that put over the abdomen that may enhance lymphatic drainage, liver detoxification, immune support. There, of course, we don't have a lot of the really solid empirical data or the good research on this, but we have a lot of anecdotal, and does it hurt? And this is why we need to know our chemistry. This is why we need to make sure that our claims are true, realistic, and we don't overdo it on our claims, and just understand that most of our evidence there is anecdotal and historical, right? All right. So castor oil packs, again, many of you have probably used this, placed over the liver and the abdomen. Those are a lot of times constipation, liver congestion, and inflammation. However, people know that their liver is congested, or if it's just like listening to their bodies mostly and deciding that. But constipation is something that I think it's really commonly used for, probably as far as home remedies. And so I'm not sure very many people think about it as increased immune function outside of maybe our circles. But placed thickly on the skin, you cover the oil with a cloth for 30 to 40 minutes. It's recommended that you use a hot water bottle or a timed heating pad, not warm. I've heard warm compresses before, but the warm doesn't stay warm long enough, I guess, to make this effective. So what little studies we have, it really relies on the heat for short periods of time. So you want to be careful about that too. So I put on the slide here just an ad for that you see on, I pulled this off Amazon. So it's out there, right? So the Queen of Thrones, I've heard the creator of this castor oil on a lot of podcasts, different wellness podcasts, just talking about the development of that and why the name of it and things like that. But this is their ad. So it's one of the more reputable ones. Anyway, just wanted to illustrate that this is on Amazon. Okay, so to induce labor, this is something that I think we've probably all heard of. I don't know if very many people admit to trying this, but castor oil stimulates a smooth muscle, and it has been used in the past to stimulate or irritate the uterine muscle and triggering contractions. And of course, you only want to do this when the body is ready. Now, I'm not saying that we should be doing this or recommending it, but there are some clinical studies that have shown women over 39 weeks pregnant who took castor oil were more likely to go into labor within 24 hours compared to those who didn't. And of course, the results are mixed, and these are small studies. It's not routinely, of course, recommended without medical supervision. So this is things that I think was traditionally probably midwives due to potential, you'd have the side effects, nausea, diarrhea, dehydration. So you wouldn't want to mess with that. I would say probably none of us are going to recommend it to our neighbor to try this. I don't know, maybe you will, but there you go. All right, constipation relief in the elderly. I've heard this from my grandma, so I'm pretty sure probably all of us have heard this or have know somebody who has used this for constipation because it does act as a stimulant, laxative. Ricinoleic acid activates as an EP3 prostanoid receptors, activates those in the intestine walls, which promotes that peristalsis. This is also why we will say that you shouldn't recommend, I wouldn't, like, especially if you're advising a aromatherapy client or operating as a wellness advocate, you wouldn't want to tell somebody to take this outside. It probably would be something you would approach with caution because there are different problems that could happen, obviously, with that. It's especially helpful in chronic constipation, which is more common among the elderly. So just knowing that history and being careful on how we recommend this as far as taking internally. Castor oil packs are applied externally over the abdomen. I would be comfortable recommending this more than I would probably taking it internally, although people do this all the time at home and on their own, right? But okay, so there's that. So like I said, external use probably preferred mostly, especially for frail or sensitive individuals, due to just fewer side effects and more control over those things. Once you've ingested something, you just have to live it out. So you don't want to get somebody in trouble that way. But I do hear people just willy-nilly advising this, but I think knowing what it does, we just need to be careful. All right, so castor oil is very rich in fatty acids. We've talked about that. And the humectant properties that draws moisture into the skin. So that supports collagen production, and that's what helps us be able to say that it may aid in reducing fine lines, scars, and stretch marks. For that, you'd mix a drop or two with jojoba, or some sources use rosehip oil, a lot of them. And we'll probably talk about what I've been using is with jojoba and frankincense, and doing that every day. You do that, just a really powerful facial serum. It feels great. It smells great. I will say that I see the most, first of all, before and after pictures drive me crazy because I don't know that they ever tell us much of anything, but except for that they're good with lighting. I don't know. But I'm anxious to hear you guys' stories, because what I see is that if you're 20 years old or you're 30, early 30s, it works fantastic. That's all I'm going to say about that. Okay, so here is a recipe that was shared at convention for a super serum. And this is topped with castor oil. So there are a lot of things that we have to acknowledge that this super serum that I think that has a lot of different essential oils in it. Do we really know then what works? So I wouldn't probably say this is a beautiful thing about castor oil, because there's a lot amazing. Look at immortelle, ylang ylang, helichrysum, jasmine, frankincense, yarrow. This is massive, and it's probably expensive. So this is an investment, but it is really beautiful. I did mix this up, and it did smell amazing, but that probably wouldn't be something that, outside of maybe it being offered as a product, I would routinely. I'm not to say it because it's sustainable. But regardless, for the skin, helping reduce the appearance of fine lines and wrinkles by boosting collagen production. Again, if you're 20 or 30, this is going to be something that you probably, and for your clients that are early, not 50 yet, this is probably going to be like something that they would want to do to be proactive, and especially if they are wanting to avoid fillers like all their friends are doing. So that would be something there too. Moisturization, castor oil provides that deep skin hydration. Frankincense improves skin elasticity. So we have a lot of good benefits there. Blends and soothes, brightens, helps fade dark spots, and draws out impurities, leaving the skin fresh and clear. That's how you can use this as part of your facial routine. So here are some of these before after pictures. Okay, do whatever you think about that. Again, that more about 2 to 1 is the add jojoba or not, but 2 to 1 castor oil and frankincense is what I was seeing mostly in the articles and the different recipes. So as a overnight mask, as a spot treatment, just as that anti-aging serum. The hair and scalp, this is also something like is doing this as a scalp massage. I've been doing this, and I did talk to a hair growth specialist. My hair stylist just got her certification in hair loss, and she did say that they did mention how different oils, and she was going to go back and check, and she thought that it was worth a try. So just in nourishing the follicles, enhancing blood flow is where she thought some of our oils would be the most beneficial, enhancing blood flow to the scalp and promoting that hair thickness and regrowth. The tricky thing always with hair growth is that you get, even when you get like the little tiny hairs that you see, are they broken hairs or are they new hairs? Not even the experts really can tell. So you really wouldn't be able to tell without a microscope on your scalp to see like where those follicles are and how many follicles are in a certain area, to really be able to measure if over time, if that's the reason for your growth or if that's happening. So it's a long process. So if this is something that somebody's dealing with, it would be recommended to probably give it 6 months to really know if it works. That's probably just the truth about it. So we have to remember that when we're advising these things, these aren't quick fixes, of course, which is okay with us, but sometimes it's not okay with the people that we share, and they want to say that it doesn't work because they didn't try it for longer. But so my expert says you'd have to give, if you did this, it would have to be a daily practice, probably morning and night, at least every night, and probably a good 6 months to know if it really is working to enhance blood flow and to really promote that growth that would be sustainable. Enhances circulation, improves root strength. I'm not sure that we can say it improves root strength. It does enhance circulation, which would therefore improve root strength. I know that those are technicalities, but if we're going to ethically share some of our remedies, this is where we need to be, right? On the evidence, or at least know what we're talking about. Yeah, so I did try the eyelash. How many of you guys have tried the eyelash remedy? No one? I did try it for a little while, but I had some problems with like the messiness of, or like how clean that was as far as putting the wand back, and I wasn't consistent, so I didn't really see the results. I enjoyed the practice, but I would find it interesting too, if would it actually work with mascara. Now, I think you'd probably have to do the eyeliner and not just on the hair. So if you really wanted to improve that. So this is the if you were at leadership, this is what you saw as far as the castor oil that is coming our way. And then of course cautions and contraindications. We talked about those through is internal use is used as a laxative, definitely should have some supervision or be used in very low doses because it could cause some other problems. Pregnancy, and I consider all of you guys to be the professional guidance. So I'm not saying that we have to send, I don't think that we as nurses need to send people to their doctors for the things that we learn here or the things that we study as far as natural remedies, because our doctors don't traditionally know anything about those anyway. So they're just going to get told no, probably. So there's that. So I think we are, when I say that without professional guidance, I consider all of you professional guidance. I consider you guys to be the professionals that are going to guide these people in their practices. The other thing is that ricin, raw castor bean, contains ricin, and that is a deadly toxin. And so you do get some of that information out there in the public. The oil itself is safe when it's properly processed. So unprocessed seeds should not be consumed. So that's the importance of having a good source as well. That's what I have. And I also, because I couldn't help myself, I made us a handout. I can actually show you. I don't have to show you that. I will post it in the membership. And there are 10 other recipes on there, but I wanted to give us time to go and hear your stories and your thoughts and how you're using castor oil. And so that we could learn from each other on how you're using this and what you're finding in your own personal practice.
This is Giselle. I don't mind sharing my experience with it. Last October, I sprained my ankle 2 different places and had a little bit of a bone break. And I had to go to physical therapy, and it helped. And I still was having pain several months later. And the doctor said if it doesn't heal like in another month or so of pain free, we can try injecting it. And I was like, yeah, I'm not going down that path. And so I have been using castor oil for some time for my face and stuff, which I do notice a difference with the little finer wrinkles. But the earth-shattering moment was when I was applying it on my ankle for the pain. And after a week, I was like, am I making this up? But I feel like it's improving. And I did it for another week, and I told my husband about it, of doing this. And every once in a while his shoulders will hurt because he had surgery on his shoulders before. And I used it for a week every night on him, and wow, he says that's really helping. And he is not into any of this stuff at all. It's all woo woo. And he now asks for me to put it on his shoulders because it helps the shoulder pain. And I think it was after 3 weeks of me applying it to my ankle that they've had complete results. And now I'll only put it on sporadically, but I'm pretty much at the point now of it never even happened. And I definitely contribute that to the castor oil, and it prevented me from getting a cortisone injection. So I found that pretty mind blowing.
Nice. So how often did you apply it?
I just did it every night. And I think the biggest thing is consistency.
Yeah, so just as an anti-inflammatory, probably.
Yeah, and sometimes I would put some oils in it, like I would put lavender or frankincense. That part I was not consistent with. I was definitely consistent with putting it on as just the castor oil itself. And I do put it on at night for my face. Sometimes I'm consistent with it. I wax and wane with that. But when I do put it on, my skin is like butter in the morning. It's just so smooth and soft. I find it very amazing.
Now, what kind of castor oil do you have? Where's your source?
It's that queen, is it Queen of
Yeah, Queen of
Thrones?
Thrones. Queen of the
Yes.
Thrones.
Yeah, from what I understand, that's a good quality.
Huh?
It's in a glass jar. It's the hex-free bottle, so that's what I've been using.
Nice. I'm gonna switch to that because I feel like mine is stickier than.
I've also used another one and it's organic, hex-free. I think it's by, I want to say Horizon, Organic Horizons or something. I'll send you what it is though. But I've used both and I think both of them are fine, at least for my results.
Nice. Thanks for sharing that. Yeah.
And I think for with what you're saying with the stickiness, if you put in a little bit of jojoba and or rosehip oil, it decreases the stickiness.
Yeah, I did. I like the jojoba. I really just wanted to see the power of castor oil. So I started out with just castor oil and then I added the rest of the things in it because yeah, I couldn't, it's too sticky by itself.
Yes, totally agree. I also bought one. It was not in a glass bottle, but it was in a roller bottle. And that's nice to use every once in a while. I've been looking for the like a 30 ml glass roller bottle, and I haven't found one to purchase yet. But that's what I would like to buy is a glass bottle and use that because it just makes the application much easier.
Yeah, mine is a roll on, definitely, because I don't want it all over.
Yeah. Yeah.
At nighttime, it's fine. It's like I put it on when I get out of the shower too. I just put it around I don't know, do I look younger, you guys?
You look marvelous, darling. Oh, and also applying heat to it as well does help. So at times, like if my lower back maybe just achy or whatever, I'll put that on and I'll put a heating pad on at night, lay down on that, and it helps penetrate the oil.
Hmm.
But yes, I've become a firm believer. I feel like I should sell the stuff.
There's a blend on the worksheet that I'm sharing with you. The anti-inflammatory joint balm, 2 tablespoons of castor oil, 5 drops of frankincense, 3 drops of copaiba, and then massaging those into the joint.
Yeah, I bet you that would be good for arthritis.
Yeah, like a little more chronic use. I still think you'd have to put something little like the jojoba oil or something that's less thick to make it sustainable, make it a
Yeah, I agree.
sustainable strategy.
Yeah,
And that is just what I find that's almost most just as important as is finding a way that people can apply it, that they will do it consistently.
because my husband won't put it on himself because it is so sticky on the hands. He doesn't like the stickiness of it, but
Yeah.
he's more than willing to have somebody else put it on. And I'm for me, him saying that that really works and him asking for it
Yeah, that's
is
big.
just huge validation because he's really not into that.
Yeah, that's a big that's a big deal.
Yeah.
We get our anytime you get a family member on board.
Yeah.
Anybody else have any stories, something that you're trying, questions?
The recipe that you showed, is that the serum that we made last year at convention? Is that the recipe that they had for everyone to make?
The one with all the stuff in it? Yeah,
Yeah.
it came right off of the
Okay.
doTERRA
That was
site.
nice. It was very nice. I added that, like a drop of that to the moringa rose oil and put that on my face. And that was very nice. But I haven't made it with my own products here in my house because that was a pricey little thing.
It's a lot. Beautiful though.
I was just going to say thanks for all these ideas because I bought some and it's still sitting on my bathroom sink and I haven't done anything with it yet. So Now I have a few
I mean, even if
ideas.
you just take it and put a couple drops on your face at night and just kind of get yourself started on using it, and it inspires other things. I have a little on my head. I have a little growth on my head, and I haven't had it checked out yet. That's next on my list, but it's new, and so I've just been putting the little castor oil and frankincense on it. I went to my hairstylist. This is how we got talking about it, because I knew she had one of those magnifiers, and we were like magnifying it 100 times, and she's trying to find us there. Is it an ingrown hair? What it is, but so I'm gonna see if I can, while I'm waiting for a dermatology appointment, maybe I can get rid of it myself. I'll let you guys know.
You might by the time you get your referral and then the other referral and the prior authorization and then the.
I know.
I was going to say call soon because our dermatologists are booked up till November, December, January when I called last month to make an appointment.
I know.
And I live in a small area.
I wish I almost thought it'd probably be faster to go get a job at a dermatologist office. Yeah. I started down the road just trying to get hormone replacement therapy in December, and just yesterday finally got it done. All right. We didn't talk about the emotional, but there's a lot of emotional, this again, uses for it for emotional relief. And again, we go to like how physiologically it gets things moving and decongests and improves circulation. So we take some of that and assign to the mind body connection and emotional grief, forgiveness, heart chakra healing. And that's also what we can use the same blends for the emotional uses. So the recipe there is a tablespoon of castor oil, 2 drops rose oil, frankincense or bergamot, whatever you have, and then applying it to the chest area, just in resting your heart to state your intention or pray or journal or however you do, just putting that over your heart. That is another way we can use that. And then I have a little spot here that I want to see if I can make an impact on it. And so I thought, oh, it can be a double use of it. Oh, the vagal nerve reset too. There's that where we can do the same thing with the 2 or 3 drops if you're not mixing your own castor oil and combining that with frankincense, and then gently massaging it behind your ears and down the sides of your neck. And you can actually almost do just to activate that, or even over your chest, taking some deep breaths to activate that vagal nerve, just to calm things down, even using you could put it over your throat and hum while you're doing that. And you have that double, like humming activates the vagal nerve. And so will then using your oil, that would be another way that you could use castor oil with frankincense. So if you do mix your own blend of frankincense and castor oil or any of those wonderful oils, there are just so many uses for it. So those are nice shareable ones too, because then you could you could design a ritual for people to use this for healthy mind, body, and spirit all at one time, covering the host of things that they are looking for solutions for. So while we're waiting for doTERRA to come out with theirs, again, the queen of the thrones, that's, I guess, a really important because of legal, that was a podcast. Why I keep saying that, because that was an important part of their name, is that the be in there. Remember, cold pressed, hexane free, amber bottles. Yeah, that's it for the most part. Who else? Your grandmas ever use castor oil? Anybody ever give you castor oil?
Stephanie shared a couple stories in the chat.
Oh, excuse me. not have a shampoo recipe with it. Eyelashes. Has anybody tried that?
I found some hair recipes via more like masks. I can paste them. I'll tell you what AI said.
I'm curious about the thyroid, lemongrass. Okay. Sounds like Stephanie has been a castor oil user. Where's Stephanie? I'm just reading. Oh, okay. Okay, castor oil using cayenne pepper. They'll look that up. Oop. Ooh, we can add that to the discussion in the community. I'm making a note about the cayenne pepper. And now we're all just reading the comments.
There, I found a few.
That no, it's a mask. Oh, can you imagine doing that to your hair?
You mean me personally?
Yeah,
Yeah, sure.
you do.
And then rinsing it all out.
You just have so much hair.
That is true. But it's saying just you're gonna just massage it into the
Scalp.
roots
So
and then kind of pull it down.
So that wouldn't be a whole lot different than using that root to tip serum. And
Yeah, except you do it dry and then put it right in the. I usually put it. Yeah, I don't put that root to tips in my roots. I mostly just put it on my ends. But yes, I do have a lot of hair.
I have my little bottle in my bathroom, and I've been putting it on my head, putting it in my face, putting it on my chest. I should put one out here, my desk here.
I probably should get a dropper for it because it just has a lid and I don't want to just pour it out. So maybe it needs a pump or something like that, a pump or a dropper.
Mine's in a roller, and so then I can roll it on my fingertip.
Yeah, I have some empty rollers. I could put it in that.
But a dropper would be good too, so that you could. The root to tip serum is a dropper, right? Yeah, it's
the old one used to be dropper, and then the new one is in a
one
pump. Or I don't know if they still sell it, but the last one I bought was in a pump.
Yeah, mine's in a pump.
I like that one. I liked the dropper one though. Well, especially because the castor oil is kind of thick.
It is, and so that's once you put like that's why mine has frankincense, and it does have a little bit of the jojoba oil in it too, just to loosen it up a little bit.
Mm.
And I like it that way. It's still a little sticky, so it still feels like castor oil, but I'm going to try that Queen of the Thrones one too next. See if maybe I wonder if different castor oils feel differently. They shouldn't, right? Not that much.
It shouldn't what?
They shouldn't feel very different much.
Oh, no. You'd think if they're all clear or whatever you want to call it, pure.
Yes, my castor oil does come in a dropper. I have this in the
I think if they're not as like the same consistency of that thickness, that it may make you wonder if there is something else added to it.
Yeah.
Because I think just in general, it is a thick oil.
yeah. My hands are all sticky. And don't get it on your glasses. I get it on my glasses, and then it's on my hands, and then I try to clean my glasses, and it's just all right, you guys. Anything else you guys want to share or talk about, or questions you have, or things you want to learn in the future before we wrap it up here?
No, thanks for putting that together.
You're still you're still going.
Yeah, that's a good one, Stephanie. The
It does
staining.
stain. Yeah. That's on the handout that I'm sharing, that to be careful because it stains. I didn't say that earlier, but yeah. Oh, so Stephanie used it when she was pregnant, and Jessie did not, or it did not work. Looks like. Wait. So yes, I have a handout. It will be posted with the recording in the community and in your portal, the membership portal. I will post that probably today, and then the recording will be sometime this week. I'll post the recording. Maybe I'll get to it today. Never do know. But the handout will be in there for sure. And then I encourage you to share all of your ideas in there, so that people that weren't here can glean from your wisdom.
Like, can we copy the chat and throw it in the replay notes? Like in the community? Are you going to post it in the community?
Oh, like all the, yeah, because one of our AI bots should pick that up.
Yeah.
Oh, I can do that on when I'll post the chat.
Yeah, just there's a lot of good comments here. Where are you going to post the handout, Julie? Are you going to put it in the community?
Yes.
Okay. So Diana was asking.
Do I have to put a picture to log into the portal? No.
Do I have to have you do to create your profile, you do need to put a photo, but you can put anything. You can make a logo, you can just do an emoji smiley face, but it has to be a little image.
You do?
When you create your profile, it requires an image. I know it's weird, but yes.
I kind of like that, because it's like this, like y'all have bags over your heads. A little hard to have a conversation.
Yeah.
But I'm glad you're here. I would rather you be here and not, I guess, not now that I said that. It creates a really interesting image in my mind. But
now people are like nervous about it.
Glad you're here. I'd rather have you here and listening than not here at all. But yeah, I kind of like that it requires it, because then you can, it is what community is about. We should be able to show our faces, unless we're driving or whatever you're doing.
Naked.
Yeah.
Diana, I'm going to help you out and I'm going to make you one right now so that you have an image.
You're making an image?
I'm going to make one for you.
What kind of images are you making?
I'm gonna just make you an image to use as I'm gonna make it with boxing gloves.
Hi, ladies.
Thank you.
Good morning. I wanted to ask Stephanie. She said that it worked for her. This is Jessica. I took the whole bottle when I was 40 weeks pregnant because I was desperate. I wanted the baby out, but it didn't work. And I think Stephanie just said that it worked for her with 1 teaspoon or something, a tablespoon. Let's see.
Maybe more isn't better.
I know.
Maybe just slid right through.
I don't know. That baby wouldn't come out. And then finally I took her out with forceps, but I took a whole bottle. And so I haven't used castor oil ever since that day, which was 23 years ago, because of the taste. For me, it was a traumatizing experience, but I did it like my grandmother was with me. She's 92 this year, and so she said it worked. And she has 7 kids, so I tried it, but it didn't work for me. But I think Stephanie said it worked for her. That's why I was like, did it work for anyone? Because it sure didn't work for me. And I took the whole bottle, and I haven't touched castor oil. But I was wondering, did you ladies have an opportunity at leadership to sample it or anything, or is it just a mention? Sometimes they offer you to go and try it out.
I wasn't there.
Oh, okay. You didn't attend. Okay. Yes,
Yeah.
I wasn't there either. Well, I don't know if there are gentlemen here as well, but did anyone try it? And then the other thing, my mom had a stroke since October, so I've been disconnected from everything. She's had 4 strokes and she's still alive. She's a fighter. She's a warrior, because to have 1 stroke is a risk, but to have 4 from October to now, and she's stable and well. But I wanted to know, where are we connecting? Because I know you're saying the community, load up your image. And maybe this helps other nurses who are also either listening, joining in, to know where we're connecting now, because I know we've changed and I haven't followed up of where we are now, because I would like to continue getting information.
Are you about to post a link, Kathy? Okay.
Hi, this is Stephanie. Sorry, it's hard for me. I'm on my phone, so I can't do the visual or the chatting very well, even. I can't find it hardly. So I've been mute too. I was just going to comment on having used it for pregnancy. My mother was a nurse. My son came on his due date, and I had gone in before the due date to get checked and whatnot. But she had encouraged me to do it just to make things move along. And sure, so I did. It was just 1 tablespoon, and I gagged all the way down. So it reminded me of the little girl's makeup that we used to have for lipstick or something is made with it. And it was just nasty. So and he came, it's just like, it wasn't like immediate right after, but he came on his due date. I think I had done it the day before. Yeah, I'd taken it the day before. And they recommend something that's used to help clean the bowels out. So you have to be careful. My sister's a labor and delivery nurse, and she was always telling me to make sure and go to the bathroom before I went to the hospital and whatnot. So you didn't have problems there, but it can release. So that's something they talk about, being careful, but it's used for when you're constipated to help things move along. My second child, she was coming around her due date and was on target. And then I got into the bathtub and she was crowning a little bit, had her head. I think she was at a 1 position or so, or 2. And when I hit the hot water, she jerked back up and went negative. So we were talking about doing the castor oil again, and it was so nasty for me with that 1 tablespoon. I said, nope, we're not. It was 2 weeks later, and I had to have her, what do you call it? My words are gone. They had to induce labor then with her. But I can't imagine taking a whole bottle. So all I needed was 1 tablespoon at that. Actually, yeah, I didn't do it. No, I did do it with her. And then the water, she went back up, and I said, I'm not doing it again. I didn't want to do it again. But it's real thick. So to take it down, but it's been used for ages by the old moms and stuff, that it's pretty powerful.
So what I'm hearing is you use it, it might work, but you only use it once.
Yeah, I did use it. Yes, correct. I did use it with both of them. I had results with both, but then I botched up the second one because she didn't like the hot water and I went back. But then I couldn't get it down again. It just gagged. That was that. So it did work for me, but yeah.
Thanks for sharing so much of your story today.
Oh, you're welcome.
Yeah, love it. What our grandmas knew.
And just remind me, for Saturdays, are we meeting once or twice a month? How is it working now?
Every second Saturday.
Second Sat. Oh, so once a month, but on the second Saturday. Okay. All right. I can't believe Stephanie, she just needed 1 tablespoon. Yeah, I drank the whole bottle. But I'm hoping that doTERRA's tastes better. And maybe we didn't have doTERRA back then, so hopefully this one will taste better. Or is it going to be internal? I don't know. Can you use it internally with doTERRA? And we use the other ones. I guess this one we can, I suspect.
Did they show the, okay, let me go back.
Yeah,
Did they-
because we mentioned a lot of topical and yeah, but I don't know internal because we did take it
I
as
think they're
Stephanie
planning, from what I heard, I think they're planning to introduce it as a carrier oil.
Oh,
External.
okay.
I don't know that they have plans, and maybe they have to do some sort of FDA stuff to do it as internal, but
Okay.
certainly as an easy path forward, they can use it as one of their kind of, they have that sensitive skin oil. So I think that they're going to do it as a carrier oil option to start.
Okay.
Just like a lot of things, then you just make your own off-label decisions. For those of you who are looking for the login, so if you for sure know you have an account, just go to login.eonurses.com, especially if you've purchased courses and stuff over the years. If you're not sure, then just go to the monthly members area. And then if you do, join there. And then for those, I usually send out, if you're not a member, like we have a 30-day free trial. So if you want to get back in and get all the stuff from the last month, you can do a trial. Of course, you can cancel it. We would hope you don't, but if you don't have an active membership and you want to check it out again, you can go in through. I usually try to send in those emails, like the option for you if you're not a member. So occasionally we open these kind of webinars to anyone just to be able to continue to share. But then for the ongoing conversations, replays, extra resources, those are all inside the paid community. Just if you're wondering how to get access, let me just see if I can grab a link for those of you who, if you go the other way, you'll get the link to join, the invitation link. But start with the login.eonurses.com because I think most of you probably have an account from at some point in the past. And that's where, if you haven't signed in through the new portal before, it's going to have you add a photo. That's why I just dropped all those little images. You can just use one of these. They're the right size to just drop in as a photo. And then later you can go back and modify your profile just like any other account. But yeah, it doesn't have a little default image. It does make you do that. So I've had to do that for other people, like just create these little images that they can drop in. But if you have a picture of yourself or your family, you can just drop that in from your phone, or you can take a selfie. Prompts you
to make it really simple for you so that if you have a period of time goes by before you're logging in again, you do get, when we post in the community, if you're in the membership, you should be getting emails when we tag everyone in a post. It operates a little bit like Facebook does in the structure of it. To make it easy for yourself, you just upload it to your home screen and it will keep you logged in there, or it'll allow your device to remember your login information. So then you don't have to go find it in the email or look for it every time or wait for an email to click the link and do it that way. So put it on your home screen and then you can just open it up just like you do Facebook and it'll come right up and remember your login information.
And our new platform has an app too. It's called Go Collab if you prefer apps, and it's on iOS or Google Play Store. And I'll type it in there so you know. It's called Go Collab, GOKOLLAB. So it's collab like collaboration, but with a K. So Go Collab. Let me see if I can find the links to the Play Store. I know I just had one yesterday. I can find them fast. Let's see.
Okay, so for I'm understanding is that we'll be connecting via the website and that community group that you've created. We're not doing Facebook anymore, or no? Okay.
Julie's in there still a fair amount in Facebook.
Okay.
Yeah, I stopped interacting there as much or posting there as much because nobody was interacting. How Facebook is, and then sometimes like you post there and the group specifically didn't see it because of the algorithm.
Yes.
So I stopped relying on that. I am always open to posting wherever people are or will interact. I know we tried the WhatsApp for a little bit too, and never really, that was probably not, I probably didn't give that a fair chance, but because it was new to me, I had a hard time with it. But again, if you guys interact, and it takes that to get it going. But I know that I use this app for my coaching group, and we have, once we got going and everybody got used to, had it on their home screen and got it so that it made it easy for them to log in, we are able to really use that, and it's been really helpful. And so we can make that. Right now that group is not super active either, but I would like it to be. I'd love to hear from you guys when we post things. It'd be nice to, we all have different experiences to learn from each other on, and so that'll be the hope. That's why we created it.
I like the text message that you sent. That was a reminder. I was unaware until I received it this morning that you were meeting today. So that was a good one, doing it via text. Facebook might be just good for reminders, not necessarily for conversation. Because I found out now where you are again because I joined the call. Otherwise, I wouldn't. I looked up the Facebook. I think there was the last post, and I'm not sure, in the mastermind group was maybe November. Yeah,
Yeah,
so
it's been a while.
okay.
And it was maintenance too. It's like maintaining who's removing members, adding members,
Yes.
things like that. That was another factor.
Makes it complicated. Yes.
Yeah, yeah. So
No, it's good. This is one place now we can go. It's the website, and then we have a community. And that's what's recommended these days, to do that. Okay.
and
That's
it's
good.
ours. We don't have to worry about
Yes. You have more
algorithm.
freedom.
Yeah. Yeah. We don't have to worry about the words we use.
That's awesome. Thank you for doing this. I admire how you guys stick with it no matter what. I love it. You guys are inspirational that way. You teach us how to keep going no matter what. So thank you. Okay, so
I'm
I'll
glad
look
you guys
into
like the text. I got that too this morning. I was like, oh, I had set that up. I'd forgotten too. Julie, can I share my screen real quick just so I can show people?
Yep.
And Diana, you're asking what's the app for? It's like putting the Facebook app on your phone, except it'll be your EO nurses.
But you have to have an Apple phone or,
An Apple or an Android.
oh, okay.
Yeah, I just put the Android one.
I don't use the app. I just uploaded the actual site to my home screen, and it allows you to switch communities. So if you're in RN Biz Hub, you to the communities that you're in, even just using that. You use the Go Collab app on your phone?
I do sometimes, yeah. I'm in and out of there as an admin, so it's hard to have that same experience. But yeah, so this is the little logo if you look in your, either in the Apple store or not. So it just depends. Julie said if you go to login.eonurses.com, you log in once from even your phone browser and then save that website to your home screen, it'll bring you in. And then once you're in, it behaves very much like any other kind of Facebook group you've ever been a part of before. You have a discussion area. There are channels. So if you have something like a book you're reading, or you find a good YouTube video, you can post things in the different channels, or you can, like here, Julie puts the meeting replays here. And then once you open the post, there might be extra stuff like a link out to Dr. Alice's website. You can put comments here. You can tag people. So it works very much like a Facebook group. So you can have here just the different articles and things. Then we have learning. This is where you can access all of your membership vault. So that's all the history of all of our archives are here. And then we've been sending you emails reminding you, don't forget you have access to this, or don't remember you have access to that, just so you remember how many things that you have. Let's see if it'll open up. I'm in the admin view, but it should. So once you're in here, you'll have access to all of those old lectures that you want to do. So I just go to categories, and then we'll have what is this month's, Then we'll have special topics. And then we have all of the archives on the self-care, healthcare, wealth care. These are some of our EO nurses online conferences. These are some of the mastermind calls. And you can just see like these are all available to you. You just click on them and then you can go back and you can see what we were talking about that month. And then you just play it right here. So that's the courses area but you can access that from right inside. This is a list of all the members, so you can chat with them if you want to send Beverly a message or Diana a message. And then the events is where you can actually come in and then you can save this to your Google Calendar. So if you want to just add it, you can do that. So you RSVP through here, and then you can grab the link and add it to your calendars. So the events, the community sends reminders for that too. There's a leaderboard where if you post a lot, you can currently Nora's #1. But anyways, so that's basically what it is. So once you're inside, discussion, learning, events are probably the areas that you'll go to the most. But yeah, that's what we've got here. So hopefully that's helpful. I put in the chat, again, the link if you want to go there, and you should be able to log in and create that free profile. Once you have your free profile, then it'll show you anything you've got access to. Some of you have bought courses from us from years and years ago. And if you've signed up for those, we've probably added them to your profile. Once you're on your login page, let's see if it'll do it since I'm the admin. It'll have here, once you're logged in, it'll have the groups and then it'll have courses. So over here, it'll say groups and then courses. And then this is also where you can manage your subscription, update your credit card, cancel, whatever. You can do it right from inside. So once you go to the home screen, you have this ability to go to the groups. Then once you're in a group, if you're in multiple groups, if you did our VMG challenge last year, this is our VMG thread if you wanted to look at it, but the VIP membership is really where you want to be. But you can, if you own multiple things, you'll be able to toggle through them. If you have older versions of our courses, then you just go to take a course, and then that's where some of our other stuff might be for you. So if you own A to Z or any of those, they might be inside those. So hopefully that's helpful for just like where you go to get stuff. But everything starts at login.eonurses.com. Diana, are you in? Did you add your little picture?
I did. And you know what? You put in the little boxing gloves remind me. I was like, oh, on my website, I was putting pictures. So I did find a picture.
Oh, there you go. See?
And it's got my mug in there.
Good. Yeah, I know sometimes it's just that. I've done it myself too, where I'm like, oh my gosh, if they go find a picture, I do think it's lame. I don't understand why they do it, but it's the system we have. So we just work with it. But to me, it's a barrier and I don't understand it, but.
That's what took so long. I was like, I got to find a picture. That's going to take time. Never mind.
Yeah. I know.
So do we have to, if we haven't signed into this one, do we create a new password? Okay,
yeah.
so I don't go
just
find
sign up using the same email address you've always used with us, create a new profile, then that will hook it to anything that you already are part of, because we added all members there, but if you've never logged in before, it doesn't have a password.
Okay, good.
Yep. But yeah, just make sure. And if you're like, I think I am a member, but I don't see it, it could just be that you're using because it's been so many years. Some of you have changed your email addresses. We may have an old email address. You're like, oh yeah, I don't use that one anymore. So just let us know too, because that can always be, that's the unique identifier we use for everything is email. So either don't forget you used your AOL or you used a Yahoo or something, or you used your own business or something. So just let us know if something's not matching up. But I think we've created accounts for everybody. So you just have to hook it in with your password. All righty. Thanks, Julie, again.
My pleasure. Thanks you guys for being here. Can't wait to hear your castor oil stories.
Thank you. I'm going to find a shampoo recipe, so I'll share it.
Okay, cool.
Julie, the
Thank you.
faster way is working for you.
It is.
I can see it in your face. I can
Thank
see
you.
it in your neck. I see your little collarbones are popping out.
Yeah, they're gonna you're gonna see those collarbones popping out.
Yeah, I could tell when I haven't seen you on Zoom for a while.
Oh, thank you.
No, you look
That was
great.
really good. It was good to be bringing all the things together and doing it.
Quick question, do we have anything for convention? Are we gathering or meeting up somehow?
Probably have to wait till it gets closer to see who's actually attending, how many and what days people are arriving, but we're not officially doing an event
Okay.
that I'm aware of, Julie. Julie promises things that I don't know about, but
This is always every year. This is a question that people ask me, and I want to say, yeah, I want to set it in motion. And Kathy's
I
Resistant
mean, I
or
don't mind
what?
to set it in motion, but we're not going to be renting a ballroom.
yeah, but
Maybe we should just meet up to eat at least. I think we should maybe do
For
that as a
sure.
tradition. Like maybe do
last
that.
year. Oh, my husband had a heart attack. That's right. I was like, weren't we gonna do that last year? I was on
Yes.
my way, and
Yes.
my husband had to have a heart attack.
Oh,
He'll
he's
do
okay
anything
now,
to
right?
keep you home.
Yep. All right. So
How's your
we'll
son?
try again this year.
That's right. Your son with the palpitations last time.
Oh, that's right. He's fine. I think we've got him off the energy drinks. I think that's
Oh my gosh. Okay. It's
so.
nice
He's a
when it's
new
an easy fix.
teacher, and he took on another university class, and he probably shouldn't. And then he was living on energy drinks, and I think we're modifying some lifestyle.
That's funny.
That's
Well,
good to
not
hear.
funny. It was scary,
Yeah.
but glad it was just that, the energy drinks.
Yeah. And he hasn't mentioned getting the bill yet. So
You might have good insurance.
well, he's on my insurance still.
Oh,
So, one more year. So yeah, he did switch it over. I needed to get all that switched over to my own insurance. He just hadn't done it. So anyway, we'll see. Or maybe anyway. Okay. You guys, thanks for asking. Have a fantastic week, and I will see you on the community now that you're all got everything set up to get there.
that's right. See you all.
All right.
Thank you.
Bye, guys.